Now we're going to talk about medication preparations and supplies. When we're done with this lecture, you should be able to differentiate between the various oral and rectal drug forms, describe various injectable drug forms, define the following type of injection, so intravenous, intramuscular, and intradermal, explain how the different types of injections differ in administration and absorption, and compare the IV injections referred to as IV push, IV infusion, and IV piggyback. As we talked about previously, drugs can be administered through gastrointestinal tract or parenteral route. GI tract administration routes include oral, nasogastric, or gastrostomy tubes, and rectal. Parenteral administration routes are those that do not involve the GI tract, including injections, topical, transdermal, and inhalation routes. The ways in which drugs are prepared is just as intensive as the routes in which they are given. Drug form refers to the type of preparation in which the drug is supplied. The route of delivery provides guidance on how the medication is most suitable for what is intended and what is the most appropriate means of absorption. Some of the different kinds of oral drugs. There are tablets, which are discs of compressed drug. They come in a variety of shapes and colors. They could be coated to enhance easy swallowing or scored, allowing the tablet to be cut. Enteric coated. So this contains a special coating that resists disintegration by gastric juices. The coating dissolves further down the GI tract in the enteric or gastric region. To be effective, the coating must never be destroyed by chewing or crushing when administered. Capsules. So this is a drug that's contained within a gelatin-type container. They are easy to swallow if needed, and the double chambers can be pulled apart to add the drug powder to soft foods or beverages for ease of patient administration. Sustained release capsule or tablet. So this is a capsule or tablet that contains drug particles with various coatings. This form of drug is designed to deliver a dose over an extended period of time. Lozenges. This is a tablet with a palatable flavor to provide a soothing effect on the throat or mouth. Patients should not swallow the lozenge and should allow it to dissolve slowly in their mouth. They are also not advised not to drink liquids for approximately 15 minutes after administration to prevent washing off the contents in the throat or mouth. Suspension. This is a drug in a liquid form that must be shaken before administered due to drug particles settling at the bottom of the bottle. Flavoring of the suspension is common and may tend to have a bitter taste as a result of being suspended in the liquid rather than dissolved. Emulsion. This is a liquid drug that contains oils and fats in water, and they're typically topical or transdermal for use. Elixir. This is a fluid extract drug with an alcohol base. It should be tightly capped to prevent alcohol evaporation and should not be used with small children or individuals with an alcoholic diagnosis. Syrup. This is a sweetened flavored liquid drug prescribed commonly for children. And then there's a solution. This is liquid formed drug that is totally and evenly dissolved. The appearance is clear rather than cloudy or settled. Many orally administrated drugs are available over the counter. The oral route is the easiest to be found and most cost-effective for administration. It is, however, not the route of choice for treatment in emergencies, acute pain, patients with physician's orders of nothing by mouth, or a patient who is unable to swallow. In that case, we can give other forms. So we have rectal drug form. This includes a suppository, which is a drug suspended in a substance that melts at body temperature. For example, it may be suspended in cocoa butter. Effective route for individuals who are NPO and don't have the ability to swallow. Enemas. This is a drug that may be in a suspension or a solution form and administered as an enema. There are some pictures of different medications here, tablets, capsules, lozenges, and elixirs. Let's talk about injectable forms. So subcutaneous, this is injected into the fatty layer of the tissue below the skin. The needle is positioned at a 45-degree angle from the skin. Generally, a 5/8 needle is utilized and is suggested for drugs that cannot be absorbed rapidly through the IM or IV routes. Intradermal. This route is generally used for allergy skin testing. The needle is positioned just under the skin and bevel up using a 15-degree angle. Due to lack of vascularity in the dermis, absorption is low. Epidural. Not typically used in an outpatient setting, those who administer must be knowledgeable of the epidural injections and typically done by a physician. This route injects medication into the catheter that has been placed in the epidural space in the spinal cord by an anesthesiologist. Less commonly used methods are intraosseous or IO, intraventricular, intraspinal, and intracapsular injections are parenteral routes which are usually limited to a physician's administration. This image here shows a intradermal injection. It's usually 5 to 15 degrees. Intravenous drug administration. Intravenous drug administration is conducted by directly injecting medication into the vein. So IVs allow for immediate absorption and availability to major organs. IVs are usually administered by physicians, paramedics, or registered nurses. The different types of IV injections include IV push. This is a small volume of drug injected to the peripheral saline lock attached to the vein, also known as a bolus. There's IV infusion or IV drip. This is a large volume of fluid, often with drugs added that infuse continuously into a vein. And then IV piggyback. When a drug is diluted in moderate volumes, like 50 to 100 mLs of fluid for intermittent infusion at specified intervals, like Q 6 to 8 hours. Other injectable forms, there's liquid, which is a drug suspended or dissolved in a sterile vehicle, like a vial. Often solutions have sterile water base, referred to as aqueous or water-like solutions. Some solutions have an oil base for prolonged absorption time. Some may come in a powder form. Dry particles of drugs must be mixed with sterile solution, diluted, in order to be administered. This is known as reconstitution of a drug. Intravenous, injected directly into the vein. This results in immediate absorption and availability to major organs. IV drugs are usually administered by physicians, paramedics, or registered nurses. Examples of IV push, IV infusion, and IV piggyback. Intramuscular. This is an injection into the muscle where the needle is positioned at a 90-degree angle from the skin. Absorption is fairly rapid due to muscular vascularity. Generally, a 1-inch needle is used for intramuscular injections. This shows here intravenous administration, different forms, IV solution, IV piggyback, peripheral IV, different topical forms. So creams or ointments, they're both a semi-solid preparation containing a drug for external application. So creams and ointments are not the same. The dose used differs between them. So creams are more aqueous in nature and more water-based ingredients than an ointment. Ointments tend to be thicker and more viscous, which affects how they are used in different skin conditions. Lotions, a liquid preparation applied externally for the treatment of skin disorders. And when applied, the lotion should be padded versus the rubbed into the skin. Liniment, preparation for external use that is rubbed into the skin as a counter-irritant. Liniment creates a tingling or burning sensation to mask the pain in the skin or muscles. Transdermal patch. So this is a skin patch that contains drug molecules that can be absorbed through the skin at various rates to promote a consistent blood level of the drug between application times. Transdermal patches vary in size, they're easy to apply, and have long periods of effectiveness. Other preparations that are considered topical are those applied to mucosal membranes, including eyes, ears, nose, and vaginal creams, rectal and vaginal suppositories, douche solutions, sublingual tablets and buccal tablets. Some are administered for the local effect, and other cases are for a more systemic effect. There's a couple examples here of transdermal patches and also some suppositories. Other forms, like implantable devices, are also available in many shapes and sizes. They're placed just below the skin near blood vessels where the medication can be readily absorbed into the bloodstream. Infusion pump utilized for diabetic patients is an example to deliver continuous supply of insulin, and implantable devices are used for chemotherapy treatment. Inhalation drug forms. Inhalation drugs are fast-acting and effective for delivering humidification and medication directly to the respiratory system. The drug is usually placed in a device that will create a fine mist or an aerosol that contains tiny droplets of medication. It's rapidly dispensed through a spray bottle, nebulizer, or metered dose inhalers. The following is an image of an implantable device, which is an insulin pump. Supplies for drug preparation. Considering the variety of forms you must administer, it's crucial to be familiar with the supplies that you would need. Supplies may include medication cups, pill crusher or pill cutter, an ampule, a vial, and needles and syringes. OSHA, the Occupational Safety and Health Administration, mandates that every effort be made to reduce risk of a needle stick injury that could lead to bloodborne pathogen exposure. Therefore, OSHA recommends safety needles with a protected sheath that covers the needle automatically after administration, and needleless devices that can be used to access IV tubing for the administration of IV push medications. The following image is an example of an injectable form and preparation. We've got an ampule, a pre-measured sterile cartridge, and a vial of powder for reconstitution. Injector pens are commonly used for insulin administration.